Today I'm joined by Dr. Rishi Chopra, a board-certified dermatologist, Harvard fellowship-trained expert in laser and cosmetic surgery. Dr. Chopra spends a lot of his time in clinical practice and doing research and has extensive experience in radiofrequency microneedling in his practice. And today we're going to focus not on just one particular device, but radiofrequency microneedling in general. Dr. Chopra, there's a lot of noise out there with different technologies, different claims. There's a lot of marketing, and most recently there's some concerns that have been expressed. I'm really excited to learn about what your experience with radiofrequency microneedling has been. You have a front row seat in a lot of different technologies over the years. How do you use radiofrequency microneedling in your practice?
Yeah, I think that we kind of lost our way with RF microneedling or radiofrequency microneedling over the last decade or so. Actually the technology was developed where I did fellowship up at Mass General. So RF microneedling was developed there. And it was developed as a way to precisely deliver energy into the dermis where we want to build collagen and elastin and build new tissue in a safe manner, but also an effective manner. And it's an incredibly useful tool in our toolbox to be able to create new healthy collagen, new healthy skin, and do so for patients across the spectrum of skin colors. And I tell patients and I tell other physicians, other providers that its clinical utility is very unique, and there's no other device that can do what it's supposed to do. So the way that device works, you're literally depositing energy precisely to a depth, whether that be 0.5 millimeters, 1 millimeter, 2.5 millimeters, up to potentially 4 millimeters into the skin, without really affecting the top layer of the skin, where we get all the side effects and potentially complications, hyperpigmentation, scarring, discoloration, that type of thing. And this device allows us to be able to do that in a precise manner so that we can target specific conditions. So let's say, for example, patients have acne scarring or they have deep wrinkles. If you want to target more laxity deeper in the skin, or target more superficial things like pores, texture on the surface of the skin. So we're able to do a lot versus like with a laser, you shot a beam of light at the skin, you're going to affect the top layer of the skin, right? If you use like a different device like a density, radio frequency, ultrasound, you go deep in the skin, you're really kind of missing out on that middle layer of the skin, and you're not able to kind of selectively control where you're going. So overall, it's been a great tool in our practice, and I use it as a primary treatment for patients. I use it as a supplementary addition to a lot of the other treatments that I do, and it's great because basically any patient can really tolerate it, because it can either be a mild treatment or it could be a more aggressive treatment for patients.
Yeah, a lot of people think that if they have radiofrequency, all radiofrequency is the same. But then you have other practices such as yours where you have non-invasive radiofrequency and radiofrequency microneedling. How do you differentiate the two? How do you decide which one you use on what patient?
Yeah, it all comes down to patient assessment, right? So I really think when it comes to recommending treatments to patients, we kind of got to pull back a little bit. I think it's so easy to just recommend a treatment without properly evaluating the patient that's in front of you. And it really comes down to a comprehensive history and physical of that patient, understanding why they're there, what potential treatments can be safe in their skin type, what their condition is that you want to treat, and understanding where that condition lies in the skin. Is it super deep? Is it superficial? And knowing the anatomy of the patient. So microneedling it really only has one modality, right? It's percutaneous collagen induction. You're essentially causing microtraumas to the skin, and your skin heals itself over time using fibroblasts to build collagen and elastin. With the RF microneedling, you're not just mechanically injuring the skin, you're also depositing energy. So it's going to be a more aggressive treatment for that patient. And more aggressive treatments are often more effective, but they also come with more side effects. So typically if a patient comes in and they have more mild concerns, you may gravitate towards microneedling. Maybe that they're a patient that has darker skin tones or is more prone to complications, so you want to gravitate to a lighter treatment, you do microneedling. And then if you want to be more aggressive with a patient, you're like, okay, I want to use dual modality, both the energy and the mechanical disruption of the skin to create an improvement. I'm going to gravitate towards a more aggressive treatment like RF microneedling.
So what type of patient are you treating with non-invasive RF, and what type of patient are you treating with RF microneedling?
So RF microneedling over the years is I think a lot of practitioners kind of just went with it as like does everything, it's like a jack of all trades, master of none. And unfortunately now, because of that, it has a stigma of not really working for a lot of the things that we thought it, told patients that it would work for. At the end of the day, RF microneedling is going to be a collagen induction device, right? It's really good at remodeling that dermis and building new collagen. And I don't think we should gravitate away from that. It does that in a way to kind of improve fine lines, wrinkles, acne scars, just kind of maintain the skin over time. When I talk about non-invasive radiofrequency, that goes deeper in the skin. It's not really working on the surface as much. When we talk about tightening, I really try to kind of avoid the T word when it comes to RF microneedling, because I think that the other devices like non-invasive radiofrequency just do it so much better. And I really like to keep those in two separate categories so we don't promise a result for a patient that's may not be achievable, or may not be achievable to the degree with another device like the non-invasive devices are. They're built to be able to do that in a more effective manner with one treatment. RF microneedling, you may get some improvement in laxity or firming of the skin, but it may take more treatments, it may be more subtle, and so I like to keep those two in separate categories.
Yeah. So RF microneedling has a reputation for being painful. You hear from many patients that they just did not want to go back for their second or third treatment, because it's usually sold in a series of 3 or more. And some patients are just like, after that first one, I didn't want to continue. How do you treat to keep the patient comfortable, and is comfortability something that affects your retention or rebooking in your practice?
Yeah, I think that I think that it's really important to have safe and effective treatments, but none of that really matters if the patient's not comfortable, because they're not going to come back for a second treatment. And over the years, I've learned that the patient experience is just as important sometimes as everything else that we do. I like to keep my patients super comfortable. I'm a baby when it comes to getting treated. Like, I numb for Botox. So like for me, I'm like, I understand what patients go through because I really feel it. And any possible way that I can make the patient feel more comfortable, I'm going to do that. So if that's numbing for longer, if that's numbing with a stronger topical medication, I sometimes use like a light laughing gas called ProNox to help patients kind of ease their time through the procedure. We use Zimmer cooling. That's like a air cooling that we use on top of the skin to kind of make the surface just feel a little bit better. I use vibration with a little vibrator sometimes, or for some patients that really can't tolerate pain, I'll do nerve blocks, dental nerve blocks in the mouth. So there's a wide array of things that we can do, but you don't necessarily need to do that with these devices. There are certain devices that are more comfortable than others or more painful than others. I often gravitate away from the ones that are more painful because patients don't like that experience, and it's just not worth it for a patient to go through that when we have all these awesome other devices that are not as painful. So there are devices that are built in a way to kind of make the whole treatment more comfortable. What I like about, for example, the Potenza, there's the ability to kind of change how forceful the needles penetrate the skin, so you can make them lighter, you can make them more aggressive depending on where you are on the face or the body, and I think that makes it more comfortable for the patient. You can change the pulse duration, you can change settings to make it more comfortable. There's a lot of variability in that device, so there's quite a lot that we can do to make the treatment, even if you don't use all that other stuff, more tolerable for the patient. And I think that's really, really important for that patient to come back for future sessions, and also just feel like they've gotten a comprehensive care when they come and see you.
So what I'm hearing you say is that the customization on the device is helping you as a provider help treat a patient and keep them more comfortable. Would you say that? Would you agree with that?
Yeah, 100%. So often when patients come in, I try to be a little bit less aggressive because I just want the patient to really enjoy that first time and not feel like as anxious and not feel like as much pain, have as much downtime. It reduces the risk of potential complications. And then I usually just escalate at every session just to kind of bring, feel the patient out, see what they're able to tolerate, because sometimes patients aren't able to go a lot higher, and it's better that you started off lighter and then gradually moved up than to go aggressive every time. I think less is more for a lot of aspects of procedural cosmetics. I think that often we're like, oh yeah, deeper is better and more is better, but everybody wants to treat like at the 3 or 4 week mark. I'm like, wait 2 months. You know, you don't have to treat at at the 1 month mark. Let things calm down, settle down a bit. I really feel like taking your foot off the gas pedal with a lot of these things makes treatments not just more effective or safer for patients, but also helps patients feel more comfortable in that position.
So you shared with me earlier that you have 6 different radiofrequency microneedling devices in your practice on top of non-invasive radiofrequency.
Yes.
How do you as a provider decide which device that you want to use? What's important for specifications and for the device in order to kind of match it with what you're selecting to use on a patient?
Yeah, one of the awesome parts of my job is that I get to play around with a lot of these devices and experiment with them. And there's different strokes for different folks. We have 10 physicians, 10 board certified dermatologists in our practice, all specialize in these types of procedures, and we all kind of have our favorite devices for different things. I'm really big on safety, and so I gravitate more towards devices that have a proven track record, that have clinical evidence, that I've used over and over again and had good outcomes with patients. And some of the devices, unfortunately, that have been built don't have a lot of those things associated with it. So, I wouldn't recommend it, nor do I use those devices. What I like about Potenza in particular is that there is a lot of tunability, right? So I like to play around my devices. I'm a nerd, right? So it allows me to do a lot of really cool things to be able to make that a very bespoke treatment for that patient. I actually think that RF microneedling is one of the it's a more nuanced procedure than like lasers or non-invasive tightening or lifting devices, because there's a lot involved, right? There's so many parameters that you can change. And if you want to be an expert in this field, I think that it is a device that if you learn how to master and the nuances to, you can really do a lot for that patient and separate yourself from others in the field. Because I really do think that if you give two different providers the same device, same settings, and one really knows the skin, knows the anatomy, knows the condition that they're treating, knows how to manually operate the device, select the parameters, and one doesn't, you're going to get completely different outcomes, and the patient's going to have a wildly different experience.
So you mentioned safety being really important to you. In October of 2025, there was an FDA letter that came out talking about the safety of radiofrequency microneedling. Tell me a little bit about what that letter was about and what your thoughts are.
Yeah, so that one letter last year kind of transformed the field. I do mostly cosmetics, and I would say after the next couple of months after that letter came out, because we were heading into the holiday season, there was a lot of anxiety, both from the provider side as well as the patient side, as to kind of what that FDA communication meant. And I think it's really important for both providers and patients to understand that it was a communication. It wasn't a warning. It was essentially the FDA was releasing a statement that said that there have been certain complications that have been associated with this modality. However, that this is a signal that they picked up, and that they're going to explore it by working with device manufacturers to find out more, as well as asking patients and providers to kind of give them more information about what's going on and understand the landscape. This was not a recall. This was not, this wasn't banning a device. This was not this was not shunning the whole modality as unsafe. Essentially, what it was saying is that this is a medical procedure that should be, that a patient should understand what they're getting into. Risks and benefits should be discussed with the patient, and that you should be trained accordingly to be able to deliver a safe and effective treatment. And what we've learned over time, because we have experienced a lot of these devices, is that this is likely due to a few devices on the market, and more so than anything else, and practitioners that didn't really know what they were doing. So I think this is great for the field because it's a readjustment. It's a way for us to kind of understand what the shortcomings are, and kind of recategorize this modality as a true safe option for patients. And we shouldn't move away from it, because for some patients it's the only device that they can tolerate, because if they're skin of color and they can't tolerate a laser, we don't really have a lot of options to treat their acne scarring or their laxity the way that we do with the RF microneedling devices. So I think it was not great when it came out because patients became very scared of devices as a whole, but I think we're going to course correct and we're going to come out better because of it. And I think that we're doing that here today, right, by having these discussions.
Yeah, so we're currently at ASLMS in Savannah, and I just heard you talk on podium about radiofrequency microneedling. And in that talk, I heard you talk about the extensive amount of publications and research that has been done in the field. And you mentioned some pretty compelling stats. Can you tell us about that?
Yeah, so if we look at the literature, right, because it all comes down to the evidence. When we look at the system, I cited 2 systematic reviews, which are basically, they looked at many different retrospective reviews or many different studies in the literature and kind of combined all the data to see all the adverse events associated with those studies. What they found was, I think, over anywhere from 1,000 to 2,000 patients that were treated, there was 0 reported cases of fat loss, right? So, if you look at the other side effects that are associated with RF microneedling, there was no different side effects than other devices that are out, or other modalities that are out there on the market. You know, you had like redness and swelling and, you know, maybe temporary discoloration, which you can get with many other devices. They're very, very normal adverse events to be associated with any energy-based device. And so what this tells us is that the modality is extremely safe. It's just there might have been some, because there's a lot of variability in how an operator uses a mechanical device like RF microneedling, there seems to be better training associated with it. And we don't even know what the statistics are on the adverse events. We just know that they were there. The FDA actually didn't release any data as to, you know, how many of these events they recorded. So that's also very important to understand that a lot of this is self-reported, and often patients don't even know what device that they got. So that's why they're trying to explore more and more about it.
Yeah, so you mentioned fat loss, and you also mentioned that it's, you know, it can be operator dependent. What are the parameters or the techniques that you think might be contributing to some of these adverse events?
So the unfortunate part of these devices is that that they can go down to 4 millimeters, right? I tell patients, or even more in a lot of other devices, I tell patients that usually I try to stay above 3 millimeter or below 3 millimeters. I don't like to go past 2.5 to 3 millimeters, just because why risk any issues in fat when we don't need to be anywhere close to that, right? So I typically try to keep the depth pretty low when it comes to RF microneedling. And if you do that, you're reasonably safe on the face as long as you don't go in sensitive areas like around the eye with those settings. It's just really important to understand the device parameters, the anatomy of where you're treating, because if you're able to do that and understand that pretty well, you should be pretty safe from avoiding going anywhere near the fat. The other thing that you can do is, you know, start treating patients and start understanding how the skin feels when you press that handpiece down on the skin. I think that RF microneedling involves a lot of hand-eye coordination, more than you do with the lasers, which is surprising, because you have to make sure that when you, for example, you pulse the handpiece on the skin, you have to be flush with the surface. You got to make sure that the needles go all the way in, retract all the way out before you move it. Make sure that they're orthogonal and they're not, you know, diagonal on the surface, because then you're going to cause tears in the skin. There's a lot that you have to understand, but if you do things properly, it's pretty easy device to master, and there shouldn't be any issues of you reaching the fat. And I think that we've seen that over and over again at our practice. We have 10 board-certified dermatologists. The practice has been around more than 10 years. We have 6 devices. We probably treated thousands of patients. Never had any issues with fat loss, so it wasn't even a concern.
Yeah, that's some pretty powerful statistics. Yeah. So having 6 different radiofrequency microneedling devices in your practice, what are the specific device features that you find yourself kind of going towards? Like, what are the specifications that you really like in practice?
When it comes to devices, we don't get a lot of feedback from devices, right? So, like, for example, if you use a laser, the skin is not telling you anything. That's why we have to use visual endpoints with some of these lasers to be able to know if we gave a good treatment for that patient, to that patient. Some of the newer devices have ways to kind of sense whether you're delivering a safe and effective treatment, and impedance is one of them. What it's able to do is basically determine whether the skin is optimized for whatever energy that you're putting in it, and it delivers consistent energy across all the aspects of the skin. For example, if a patient has very old or young skin, or very scarred skin, or very healthy skin, the impedance changes, and then therefore the same amount of energy that you deposit can be wildly different across areas of the skin. The impedance monitoring allows you to kind of adjust that along the treatment and make sure that you're optimizing that throughout the skin in a very safe way. Very few devices have that, so that's always very nifty when we have that on a device. I like the fact that we're able to, for some of the devices, adjust the force that would deliver the needles, right? Like I talked about, it's very operator dependent on how you deliver these treatments. To be able to kind of also add a factor in, like if we're treating the body, you use more force to kind of get through that thicker skin, rather than jamming the needle in every time that you press down the handpiece, versus the eye, or in the periorbital area, you want to be much gentler. And now I don't have to be as gentle when I'm pressing down, because the actual device does it for me.
So for those that are new to aesthetics, give us a quick version of what impedance actually means.
So impedance is essentially the resistance of the tissue that you're treating, right? And so your skin, my skin, we're going to have different impedances just based on certain properties. The way that the RF microneedling device works is through the needle, it's depositing energy into that tissue. Think about it as a current going through the tissue. Impedance is a resistance that's in the tissue. It's an inherent property to your skin and my skin in different areas of our skin. So if in different areas of our skin the resistance is different, the energy is going to be applied differently in those areas. So for example, if you have very scarred skin or you have non-scarred skin, the scarred skin is going to have a higher impedance, so there's going to be greater energy deposited in that skin than if it was healthy skin. And so these are things that are really important to understand, but if the device can do it for you, you have to think less in kind of how you deposit that energy, and you deliver a more consistent treatment every time for that patient.
That makes sense. So in depth of treatment, we've talked a lot about depth. We've talked about volume loss. It's a very big variable when you talk about radiofrequency microneedling. Where do you try to target in order to get the best clinical outcomes?
So it's important to be in the dermis, obviously, which is the middle layer of the skin, but that's quite a large area of the skin, right? And it's different in different areas of the face, different areas of the body. I try to deliver the safest treatment possible, and to do that, you have to be actually in a very specific area. You have to be above the fat, like we talked about, but you don't want to affect the top layer of the skin. So I always say that if you stay within 2 to 3 millimeters, you're going to be in a safe area, because you're never going to be near the surface of the skin, and usually you're not going to be anywhere near the fat. And that's enough that you're in the lower part of the dermis, where you're going to get all those fibroblasts that build the new collagen and elastin. Obviously, in different areas, you want to target different conditions or different concerns, but generally that's an area that's a sweet spot, I think, for tightening, for acne scar, for wrinkle improvement.
So you mentioned targeting the dermis, targeting the fibroblast response. For those people that might not understand how radiofrequency microneedling is achieving those clinical endpoints, can you explain how RF works in the tissue and what you're trying to achieve to get to a clinical outcome?
Yeah, so with any of these devices, I always say that we're basically doing a skin workout, right? So it's like going to the gym. You go to the gym and you take a barbell and you start working at that muscle, and what happens? You get these micro traumas in the muscle, and your body goes, oh wow, there's these injuries here, I have to create new healthy collagen or new healthy muscle in that muscle, right? And so it's the same thing in the skin. So we're caught through these micro injuries, through needles, through radiofrequency energy, our body hosts an inflammatory response, and our body goes, oh, there's some unhealthy inflammation going on here, we need to create new tissue in that area. And that's how these fibroblasts are able to build new collagen and new elastin production that creates new skin has greater elasticity, that's healthier, that has less wrinkles, fine lines, texture, whatever you're trying to improve over time.
Now, there are a lot of different device features out there with different devices. So there's monopolar, there's bipolar, there's 1 megahertz, there's 2 megahertz, there's insulated needles, non-insulated needles, semi-insulated needles. There's so many different factors and so many different things to customize those treatments. So tell me a little bit about how you approach a treatment, like selecting treatment parameters and kind of how you use those to achieve the best results for your patients.
There's whatever you said, whatever you just said. There's a lot of parameters, right? Especially for RF microneedling, it makes it awesome because it's very versatile. However, I try to keep it simple. I honestly try to keep it simple. Um, I try to break it down. I think the easiest way to break it down is if it's a patient that's has very low risk, then you can kind of be more aggressive. So what does more aggressive mean, right? It means your needles don't have to be insulated. It means that you can maybe go a little bit deeper in the skin. It means that so your depth can be a little bit greater. If you're talking about monopolar or bipolar, bipolar, again, this is very technical, but bipolar is usually a stronger treatment than monopolar, right? So I just break it as to what's going to create the most aggressive treatment and what's going to create the least aggressive treatment, and then kind of vary it based on where that patient lies, and then if there's certain conditions that I treat, then tune it further. I think if you get into the nitty-gritty of it, it gets complicated, but if you just break it down into aggressive and not aggressive, it's an easier way to kind of understand these things. But if it's your first time using one of these devices, I would just say, hey, keep the energy settings low and maybe use a semi-insulated needle so that if there is any issues, you're not going to cause a lot of issues for that patient.
So let's talk about that first-time user, brand new to aesthetics, trying to build a really good toolbox, so to speak, for their practice. You have extensive experience with many different devices. If you were to guide a new buyer on what they should be looking at to buying a radiofrequency microneedling device, what would you say is most important?
Honestly, the company that you're buying the device from, and I can say that about any device, not just RF microneedling. You could have the best device in the world, and if you don't have the support and the training from the company, then it's really not going to do what you want it to do in your hands. You want to ensure that the company and the brand behind it is able to not only kind of support you with the use of the device, but then train you, but also that they've done the studies to provide clinical evidence for a lot of whatever they're saying that the device works for, getting the FDA clearances, whatever that means. And then if you treat different skin tones, if you have quite a diverse demographic, make sure that the needles both have the insulated and semi-insulated tips, because often, if let's say you have a skin of color practice or 50% of your patients are non-Caucasian, you may not be able to treat a large percentage of those patients just because that device doesn't have that particular tip. I think that's actually a huge barrier to be able to treat your whole patient population.
So on the same kind of thread, there are also a lot of different technologies. So we have, so when we're treating, let's say, skin tightening or trying to stimulate the collagen and elastin response in the tissue, there are things like high intensity focused ultrasound, there's laser, there's non-invasive radiofrequency, and we're all trying to achieve the same thing for the patient. How do you differentiate between those those multiple technologies?
I think that we separate those into two different categories. At least that's how I use it in my practice. I think of the non-invasive devices like the RF and the ultrasound as more tightening, deeper devices, and RF microneedling as a almost a little bit more invasive device that's able to do both a little bit of superficial, a little bit of deep. I think the RF microneedling gives you more versatility in that regard, and then I try to keep like you said HIFU and the other radio frequency devices in a completely different category, which is more broad global tightening, which a lot of patients desire nowadays. They don't necessarily want needles that are relatively invasive in multiple treatments to kind of get a result, and they want maybe just do one treatment and try to get a result in a couple of months. There's different strokes for different folks. I think there's patients that still gravitate towards, like I have patients that come in, they're like, I want to do my 4 to 6 sessions of RF microneedling. I like how it makes my skin feel. I like how it remodels, my texture. And that's not going to be, in my mind, a non-invasive device. I think those devices do much more deeper global tightening, and you kind of have to separate those in your mind and for the patients to understand.
So money is not an option. You're opening your own practice and you're starting from scratch. Is there room for all of these technologies in your practice in order to get the best outcomes for your patients? Or do you think you need, do you want multiple different ways to treat patients like that?
Of course. Any way that I can create a more customized treatment for my patient based on their concern is going to be better for my practice and better for that patient, right? It isn't one size fits all, and I think that's kind of what we discussed earlier. RF microneedling was kind of proposed to be this jack of all trades, but we found out that by doing that, you're not going to be a master of any of those trades, right? So I like to have specific devices for specific purposes, even with the non-invasive devices that are not radiofrequency microneedling. I like certain devices on the jawline. I like certain devices in the submentum. I like certain ones for brow lift, for body, and I kind of need all of them. Like obviously I'm really lucky to have all of them. Obviously, it's impossible to it's impossible to have all of them. But if you have the ability to do that, why not? Obviously, there's certain devices that may excel in certain areas over others, and you got to see what's best for your practice. If you have a lot of patients that come in and let's say they come in for body, maybe you don't want a device with a handpiece that's this big because it's going to take you forever, right? So there's different things that you should look at based on what your practice demands.
So I have had the pleasure of watching you in practice and watching you do some pretty savvy treatments with combination protocols. Can you tell us a little bit about how you use RF microneedling in combination protocols?
Yeah, so what I love about the RF microneedling device is that the energy is deposited pretty precisely wherever you want it to go. So as long as you haven't treated the other parts of the skin, you could use another device at the same time. So for example, if I am treating pretty deep in the skin with the RF microneedling device, I now can kind of treat the superficial parts as well to give the patient additional benefit. So maybe I'll resurface the same day with a light CO2 laser or a light 1927 to help the patient improve the pigment, photo damage, redness, whatever it may be on the surface of the skin. I like to combine it with maybe same day filler, biostimulators, the certain tips like the pumping tip. You could actually do device-assisted drug delivery or RF microneedling-assisted drug delivery, and we can lay on tranexamic acid for melasma, we get neuromodulator to help scars, filler to help kind of hydrate the skin or volumize the dermis of the skin. We have a lot of patients that are scared of filler now, so it's a good way to kind of do so without needles in a very subtle manner, where patients are getting similar benefits to filler without actually injecting deep and causing those overfilled phases.
So for those people who are listening that don't know what the pumping tip is, can you tell us a little bit about what that is?
Yeah, so I'm a huge believer in laser-assisted drug delivery. I'm not so much a huge believer in RF microneedling-assisted drug delivery because I don't think most of whatever you're putting on gets into the skin. And so the pumping tip, because most of that is passive, right? You just basically, you do the treatment and then you lay that, whatever the topical is on afterwards. I don't think a lot of it gets in because usually the patient's bleeding afterwards. So how is it going to get through the blood? With this tip, the pumping tip, it's actually actively injecting a lot of that topical that you lay on deeper into the skin. And there's studies that show that you have almost a 70% improvement in that penetration into the skin. So you can lay down, like we said, tranexamic acid for pigment, neuromodulator to kind of help relax the skin for scars, low G prime fillers to kind of help hydrate or volumize the skin. So there's a lot that we can do that we weren't able to do before. You can do PRP, for example, exosomes. We talk about peptides now. So there's a lot of cool things that we can potentially play around with, and the patients are asking more and more for combination treatments as they focus more on like regenerative aesthetics and things like that. So it's a great way to kind of actively deliver medications that we weren't able to do before.
How do you decide whether you're going to do like just insulated needle, regular RF microneedling treatment versus a pumping tip treatment?
Why not do both? Yeah, so I often do both. So I often do the RF microneedling tip first, get that collagen stimulation, and then afterwards I'll go back with the pumping tip and I'll deposit whatever I want to deposit. That way I can either deposit it in concentrated areas where I think we need it, for example, the filler or over areas of pigment. And then your patient gets kind of multiple benefits with the same device.
So you mentioned regenerative medicine, and I do think that there is a trend in the industry that going towards more natural type of results and maybe even stepping away from the filler. People are afraid of filler. They're less desiring that type of look. Would you consider radiofrequency microneedling a more natural approach to achieving volume or tightening in the skin?
Yeah, I would say most of my patients now have filler fear or filler fatigue. Unfortunately, I think, again, we went a little too far with the needling, with the other needling. When we talk about dermal fillers and what they were purported to do, it was supposed to fill the dermis. When we think about how we actually use fillers, they go deep and they kind of volumize in a way, almost in the fat. We weren't even really using them the way that they were supposed to be used. I think about these devices as true dermal volumizers, right? Because we're building collagen in the dermis. That's what the fillers are supposed to do. So I tell patients all the time, if you keep up with these devices early on, let's say you start in your mid-20s, for example, or late 20s, and you do this routinely, the goal is that you don't have to volumize the same way with fillers. And so patients, when they hear that, they're like, oh my God, this makes so much sense, because if you build that collagen early, or you keep that collagen, bank that collagen early, maybe you don't ever have to use fillers the way that we traditionally use fillers. Maybe it's more like a little aliquot here and there rather than these big cheeks or big lips or whatever we were used to be doing.
Yeah. So, you used the word a while ago, we were talking very technical, and you said, it's going to sound nerdy because we're talking in technical terms. If I were a patient coming into your practice and I was brand new to aesthetics, how would you describe RF microneedling to me as far as the entire patient experience and what to expect, when to expect my results?
It's critically important to be honest with patients, okay? So so when any dermal remodeling device that's gonna build collagen, I tell patients you're not gonna see results for at least 3 to 6 months, and you kind of set that tone from the get-go. I have so many patients that come into our practice, they're like, oh my God, I got this treatment done, the RF microneedling, my skin looked great for a month, and then after that, I didn't really see anything. And it's because the expectations were all wrong, right? So what they probably saw was the immediate glow from a little bit temporary edema or swelling, and maybe there was some light resurfacing, and then, I'm sure there was benefit, but it's not something that the patient necessarily could see over time because they didn't go back for a second, third treatment because they're like, oh, my results went away, or they just weren't told that they needed a second or third treatment. It's really important for patients to understand we're basically causing a response in your skin that your body has to do over time. And I don't want you to look at your skin for at least I don't actually let patients look at their photos if they're doing something like that for at least 3 months. Because I'm like, I don't care whether you look better or worse over that period of 3 months. It doesn't matter towards your end goal. You just gotta trust the process. And so setting that expectation early avoids a lot of kind of miscommunication, misunderstandings early on so that you don't get into those issues and then the patient's not hoping like next day they're gonna see a result, next day they're gonna see a result, and you kind of have a defined timeline. It's also important to understand what that patient came in for. Like if they came in for an issue with pigment or redness, maybe RF microneedling isn't the first treatment that I gravitate towards. Again, it's not a jack of all trades, right? I tell patients this is going to be a marathon, not a sprint, right? Because usually these treatments have to be done in succession. It's not one and done. We're building collagen over time, and so you're going to come back for monthly treatments. Unfortunately, there's no quick way to the finish line, and a quick fix is often not going to get anything that purports to be a quick fix is probably not going to fix your problem. I think that setting that straight early on helps patients kind of understand what they're getting into. And either that's for them or not for them, and that's okay, but they should understand that going forward.
Yeah. Going back to the combination protocols, we talked about topical delivery with the pumping tip. Are there any other like energy-based devices or laser treatments that you often do together with radiofrequency microneedling, same day?
Yeah, often we'll do a light CO2 resurfacing treatment or ablative treatment. I'll do a subablative treatment like a 1927 to kind of help resurface the pigment. I will do like a VV MER DermaV for redness. I will do pigment laser like a Pico or a Q switch to take off sunspots, discoloration, sun damage on the top of the skin. I usually try to pair it with something a little bit more superficial and something more pigment related, because often, like we talked about, these treatments take time to kind of see the results, and so to kind of give that patient that extra boost or that immediate improvement early kind of helps them trust that process. Like, oh yeah, this is going in the right direction, because obviously it's going to be all right at the end and they're going to get an improvement, but sometimes the patients have to see something more definitive, and it's a great way to kind of build trust with the patient as well as provide them a better result.
Yeah. Going back to the FDA letter and the safety of radiofrequency microneedling. We talked a lot about how providers approach this. If I were a patient coming into your practice and I'm coming to see you and I'm interested in radiofrequency microneedling but concerned, how do you dispel those concerns with a patient?
It all comes down to just straight up education. It's being transparent and knowing kind of what the landscape is, what all that means, so that you can distill it down for the patient in front of you. I still get questions, even my patients that have been my patients for now more than a year, 6 months to a year. We've discussed this many, many times, but they'll come in the next time and ask, will this cause fat loss, over and over again? You're going to get these questions, and you have to understand what that patient's psychology is and how to best frame it. I don't think there's a better answer for that. It's like be honest. I'm very honest. I'll tell patients no all the time. This treatment's not right for you. You're too young for this. Like, this is going to make you look crazy. I think that patients appreciate that, and I think your practice is going to be better for it because you're going to have realistic patients that understand kind of what the expectations are. But I think I like to under-promise, over-deliver. I think that's really important. I like to often say that this is going to really hurt when it's because the patient's only going to be happy with you when they're like, oh wow, this wasn't too bad, and you really save yourself a lot of heartache and a lot of anxiety, because you just don't want a patient that's going to be upset at you, for sure.
So tell me what honest sounds like. I'm your patient today. I'm in your practice. What does honest sound like? I'm concerned about volume loss.
So if you really wanted to be honest with the patient, you could say that, listen, the device goes down to 4 millimeters, right? If I pressed really hard on the skin and it went down to 4 millimeters, I may cause fat loss, okay? We do things right here. We're going to assess you. We're going to make sure the parameters are right. We're going to make sure that the procedure is optimized for you, and we don't have any issues with fat loss in our practice. Having done this for 10 years with 10 different doctors, treating tens of thousands of patients, because we do things properly. And I think that if you're just honest and then also show patients kind of what your experience has been, and that you have a track record for that, the patients are more likely to trust you, because you have both transparent communication as well as a lot of evidence showing you, the patient, that there aren't any issues.
Dr. Chopra, thank you so much for spending some time with me today talking about radiofrequency microneedling. It's been a pleasure.
Thanks for having me. It's great. Yeah, we got to talk about the FDA, talk about why RF microneedling is cool, and then combination treatment. It's awesome.